Thank you very much, Representative Garland. Now we'll spend a few minutes in Q&A about some of the things you've said and some of the issues that are out there. Let's start with Medicaid and what you commented on where Sherrod Brown stands on the issue of Medicaid. This is a very, very important issue, obviously. It's the white-hot core of a lot of this debate. Now, what Republicans say is that by block granting Medicaid, we'll have a better shot at controlling costs, and you give more flexibility to the states to provide these services, that the states are better off doing this closer to the local level than the federal government. What's wrong with that argument?
Well, I know I've talked extensively with Senator Brown's staff in regard to that, and he really feels that by block granting, unfortunately, some very important issues may get lost in the mix. And he also feels we know when times are tough, and I sit in the state legislature, I know how difficult these decisions are, that unfortunately, lots of times the programs that the people with disabilities care about the most don't get funded. And so that is really the fear. If you block grant and then you decrease those block grants, what's going to happen with the programs that are so important to people?
And give us some examples of the kinds of programs you think would actually be jeopardized by this.
Well, I think lots of the programs in terms of the specific things like go to autism. I have to say here in Ohio, we're working very hard to get legislation passed that would require insurance companies to actually cover autism. We've been trying to get a much broader program here in Ohio, and I know Director Martin has worked with the governor, but all we have right now is a pilot program. So I think those states that actually have, we do have money out there that's supposed to be helping in this regard. I think we have the research in regard to Down syndrome because of the fact that it wasn't included in the Children's Health Act. Again, money that is allocated, I'm afraid, will be put in the block grant, and these things will get lost when it comes to...
You're a state representative. You work here at the state level. Why do you think this would get lost in the state of Ohio? I've talked to people who say actually the greatest amount of accountability in government exists at the state level because you have access to your governor, you have access to your state representatives the way you don't necessarly in Washington.
You promised me softball questions, so it's not happening.
They told me to do a debate, so...
Again, I think we need, a mix in this regard in terms of you certainly need to give the states, flexibility to be able to develop programs that are good for their citizens. But I think when you lump everything together and put it in a block grant, then you do lose control. So I think that we need to have a partnership with the states, and I think again, that's actually happening in some instances where the federal government is saying, okay, we're going to give the state more flexibility, but they're still going to make sure that those programs and those people get the programs they need and the funding that they need. Because again, I think we in the state legislature, we have our things that we like and things that we don't like, and so depending on who happens to be in control at that particular moment, things may get lost.
You mentioned in your comments about where Senator Brown stands on reform of Medicaid, the notion of affirmatively reforming Medicaid to address the institutional bias that it's got. Could you talk a little bit more about that and how he would do that and how he would pursue, from what he's done so far, addressing this institutional bias to deliver services more obviously closer to the community and to the family and individual?
Right. Well, and I think we have an interesting situation here in Ohio in this regard, and it started under Governor Strickland's administration in terms of providing more flexibility so people could get more home care, and Governor Kasich and Director Moody have continued to move in that direction. But I think that we still need to have more formulas, more direction that really says, we know it's $17,000 a year to keep someone at home, to have them cared for at home, whereas it costs, I believe it's $74,000 on average in a nursing home. So he would really like to see legislation passed, regulations that would give more flexibility in terms of how we spend those dollars, and so we could have, I mean, we know surveys show that people, I think it's 93% would rather be cared for at home. And I know I've been through this situation with my own mother. You know, at some point, you're not always able to take care of people, but those are the people that need to be in a nursing home. You take the 19-year-old that was severely injured in an auto accident, and to have them living in a nursing home for the rest of their life is not what you want to do. So again, I think we need to give as much flexibility and more, you know, waivers and money that would go towards keeping people at home if at all possible.
On Obamacare, or Obamacares as you call it, you talked about the lifetime cap. You talked about pre-existing conditions, the things that are delivered in this. As you know, the Republicans stand for repealing Obamacare. What is the Democratic response to what would replace it if they were operating as a minority party?
Well, first of all, I'm not really sure that they're against repealing it, because I listened to, you know, Governor Romney, and one day he's for it, and the next day he's against it. So I'm not really sure, because he said, you know, in terms of pre-existing conditions, well, we wouldn't do away with that, but it's, you know, we wouldn't force the people to buy insurance companies to cover pre-existing conditions. So I haven't really, you know, figured out how they're going to do that in terms of life caps and everything. And I think, again, I'm amazed at this discussion that we are having because of the fact, first of all, that our Republican presidential candidate actually passed what was Obama-Romney-Care in Massachusetts, and now because we have somebody of a different party that passed it in the legislature, that therefore they're opposed to it. The other thing is something that was the Heritage Foundation's idea, a very conservative think tank, that people should be required to pay for insurance, which obviously will help to fund the other things that we just mentioned. I don't understand why we're now against that. So that's kind of my response is I don't get it.
Let me move to another category that you addressed in your comments, which is employment and job security. We know that the disability community has been hit especially hard by this recession, losing 1 million jobs from those who have been employed over the past several years. I'm interested when you talk about the ABLE Act that Senator Brown supports and other meaningful employment phrases, how he would get there. What exactly is he going to bring to bear? Does he pledge to bring to bear as a candidate or a re-elected senator that would materially address this?
Well, I think that he feels that we need, rather than, and I understand sometimes, you know, children that are disabled are automatically, you know, put in shelter workshops and things, and not given the opportunity really to go out in terms of the workforce. So I think to make sure that people are able to work up to their potential in the least restrictive environment that we can. I think also, I mean, we have the WEA Act, the Workforce Development Act, and I think we need to make sure that those agencies actually make sure that they are looking at the needs of the disabled and trying to actually have them employed. I know the WEA Act has been up for reauthorization for some time and still has not been reauthorized. So I think that that's an area that we could really work on in terms of, you know, providing assistance in employing people with disabilities. I will go back to my daughter, who again, successful. I mean, she argues cases in court. I don't know how she does it. But, you know, just having, you know, some help in the courtroom, again, has helped to make her a very success. So those are the kind, I think we can do things that in many instances are not that expensive, but again, until we're kind of pushed to do it, we don't necessarily do it.
Let me draw you out and absentia, I guess, Senator Brown out a bit on the issue of the subminimum wage, which is also very difficult.
Yes.
So my sister for years had this great job caning chairs. She loved it. She felt she was an artisan. She did it for a long time. I have a few of them in my house. I tried to sell a few of them to get us all rich. Didn't quite work, but hope springs eternal. But as she got older, she developed arthritis, and now she's not doing that. But during the years that she had that job, she worked 4 days a week, and every couple of weeks she'd get a check for $12, $14, $27. On the one hand, I felt this is a bad thing. This is nothing. She's working for free. On the other hand, I recognized that if she needed to be paid at a minimum wage level, she might not have had that job. This is difficult. Where does Senator Brown come down on this?
Well, he feels that we need to not have people paid minimum wage for doing jobs that, you know, if it was an able-bodied person doing that job, you know, I do understand the problem in terms of, okay, maybe we have less jobs if you're having to pay minimum wage. But again, I think that we need to push. I think Senator Brown would say that we need to push that envelope. I have a cousin who Down syndrome, and he's 46 years old, and he lives in Cleveland, and he has worked in a grocery store for a long time. New people bought the grocery store. And it was a Chinese family, and so everyone that had been working previous to that were let go, except for my cousin Michael, who was the only non-Chinese person that's now working in that grocery store. So, but it's because he did, you know, such a good job that and so therefore they are paying him, you know, regular wage. They didn't keep him on because he was getting minimum wage. So again, I think that's where Senator Brown would.
What are three concrete things that could be done to assure people with disabilities a better shot in the job market?
I think we need to be able to, and again, I'm not quite sure what Senator Brown would say in this instance. I'm kind of talking about Nancy Garland here, but certainly. He feels that we need to do everything we can to inform, educate employers in terms of what people with handicaps, you know, can do. And I think that's a big part of it because, again, it's kind of like we talk about my cousin Michael. You know, once these people, they didn't know Michael until they got to know him. So, you know, now they're going to, you know, hire more people. I know we have employers here in Central Ohio who they are primarily hiring people with handicaps. So I think, as with almost everything, education is so important in getting people to realize that we are all Americans and we are all people with civil rights. And so we need to do everything to get us to be able to live to our fullest potential.
One more specific question, then I'll close with a general one. You cannot listen to the political discourse and debate these days without knowing that the budget is crazy out of balance, that there is a fiscal cliff looming, taxmageddon, call it what you will, who knows what the end of the year holds. But really in any scenario, there appear to be almost certainly budget cuts ahead. When you think about the disability community, what are the budget cuts that you think are most likely and that worry you the most?
Well, again, I'm not in the Senate, so I'm not quite sure, you know, where they.
But from the
they
state
may
level,
come.
you see this both knowing the candidate, but also
Right.
knowing what, if I can use the term, trickles down to you in the state.
Right, and it obviously, you know, depends in terms of what candidate is elected. But I do think that we need to ultimately, you know, raise some revenues, but we also need to make some changes in terms of looking at, you know, various aspects of various disability programs to make sure that we are providing them in the most cost-effective way that we can. And I will go back to our earlier discussion in regard to long-term care. Because I think if we can save money if we have people that are in lower cost places, so rather than spending the $74,000 a year of having somebody in a nursing home, and we can have $17,000 of having them living in at home or a similar environment, then I think that we can certainly, you know, save some money there. So I think those are the kind of things that we're going to have to look at in terms of trying to balance the budget. It's not going to be easy, but we need to have give and take on both sides, and that's the thing that I feel that we've. Senator Brown would say this too, that as far as bipartisanship, that we need to work together. And so many times that's not, you know, what's happening. And so I think we just passed a pension bill here in Ohio, which we worked together, and it passed unanimously. And nobody would have dreamed that, you know, 2 years ago. So I think that's another critical part of this, is there has to be give and take on both sides.
And here's my last question, and I'm going to ask this of all the people I talked to today, so you know that it will be equitably spread around. Certainly all eyes are on Ohio right now, right? Because everybody's talking about what Ohio does may determine or largely determine the outcome of the election. Let's set that aside for a minute. So you can draw on your Ohio background to be as sharp as you would like in response to this. Next week, the presidents will debate. The presidential candidates, contenders, will debate. Tens of millions of Americans will watch this debate. If you were the moderator, and you could ask a question that was relevant to the disability community of the two candidates, what would you ask and why?
Well, I think that the question would be, because we know, and I would ask it more of Congressman Ryan, I guess, but since he is the VP candidate for Governor Romney, I would say, how are you going to ensure that people with disabilities are going to be able to get the services that they need if you are going to block grant Medicaid?
So you'd go to the block granting and the Medicaid question as the principal question. Thank you, Representative Garland, for being here and for your comments. If Jim Laird drops out of next week's debate, I'll put your name up for contention. I'm not sure Governor Romney would be very happy with that, but Barack Obama surely would be. We'll have an opportunity to talk to other folks with different perspectives throughout the day. But your insight as to where Sherrod Brown is coming from, and we'll have an opportunity, as you heard, to hear from Sherrod Brown himself a little bit later.